COVID-19 vaccine Q&A. My name is Kathy Piantagini, and I serve as Director of Somerville's Public Libraries. The mission of the Somerville Public Library is to act as a trusted community connector, and we have a long tradition of providing cultural and learning opportunities for all. It seems there is no time more critical than now to make sure we are doing our very best to support your information needs. Tonight's discussion is being hosted on the Zoom teleconferencing platform, which includes a call-in option. Attendees are muted upon entering the meeting. During the Q&A, you may ask a question by using the hand emoji or the chat feature if you would prefer to write it out. The discussion is being broadcast live on Somerville's EdTV Channel 15 and streaming live on the City of Somerville's website, somervillema.gov/TV, and Somerville's YouTube channel, youtube.com/Somerville City TV, and on the City of Somerville's Facebook page. The discussion will also be repeated at Somerville's GovTV and EdTV. That's channels 13, 613, and 15 on RCN, and channels 15 and 22 on Comcast, and will also be made available on demand at Somerville's YouTube channel. For more vaccine information, answers to your questions, or upcoming informational events, please visit the city's website at somervillema.gov/COVID vaccine. This is also the site where you can get vaccine information sessions in other languages, including Spanish, Portuguese, Haitian Creole, and Nepali. To find out when and where you can be vaccinated, visit the state's website at www.mass.gov/COVID vaccine. I have the pleasure right now to introduce Mary Casesso. Mary is the Chief Community Officer and President of the Cambridge Health Alliance Foundation, and she's going to be facilitating tonight's panel discussion and Q&A period. My thanks to Mary, Dr. Miller, and Mr. Kress for taking the time to be here tonight. Thank you.
Thanks, Kathy. Yeah. And I'm here in East Somerville tonight with my family, getting ready to ask two of my favorite people some important questions. And if not only my questions, but yours, we look forward to everybody calling in or texting in a question, because this show is about you and it's about getting the information that you need. So Kathy Miller, I just want to, so Dr. Miller works at Windsor Health Center. She's an award-winning teacher at Harvard Medical School, and she's a very beloved member of the CHA team. She speaks several languages that she taught herself. She's done work with the Indian Health councils in the past. So it gives you a sense of who she is and her commitment to our communities. And Doug Kress, I think I talk to him at least once a day. There's no more dedicated city person. And if I had to nominate someone right now who has done it all, has stepped up at every level, it's Doug. So we've got two terrific people that from the medical front and the public health front can respond to a lot of questions. So do participate, ask us. And I'm going to start off by saying I'm inundated when I'm in Somerville, whether I'm shopping at Market Basket or just walking to work, with people asking questions, either about vaccine safety or vaccine access. So maybe we should start with vaccine safety. And Kathy, I'll direct this one to you a little, because so many people think it was only 5 months. How can it be safe? So maybe you can tell us a little bit more about really what we know about the vaccine and its safety, and that it wasn't just 5 months in the making.
Fantastic. Thanks, Mary. So hi, everybody. Just want to let you know that I'm speaking to you from Somerville myself, which is where I live. And for the last almost a year, since the end of March of 2020, I've been working at the Cambridge Health Alliance acute care clinic, which is where we care for all of the patients who have symptoms of COVID. So I've I've become much more deeply acquainted with this infection than I ever hoped to. And I just want to tell you all that the vaccine is an amazing, good thing. And speaking about safety of the vaccine, so most of us who work at the acute care clinic, we're all primary care doctors, and most of us also were teachers at Harvard. So there are a lot. I'm from Arizona. I've been in Massachusetts for 20 years. I am not yet a Massachusetts person all the way down to the bone, pretty close. But these Harvard people are really smart. And we looked into the vaccine quite deeply before we ourselves agreed to take it. We were a little worried. And I just want to tell you that after really thoughtful looking into how this vaccine was developed, the technology that it represents, and the trials that were done, we universally came to the conclusion that it is a good vaccine, that it's safe, and that it's effective. The technology is relatively new for a vaccine for an infectious disease, but this technology has been used to help bodies recognize unwelcome invaders for many, many years. The mRNA vaccine technology was used to help people overcome cancer, actually really specific to their cancer. So now some really brilliant people at Moderna and Pfizer figured out how to use that technology, which is really nimble, which is part of why they were able to develop it quickly, into teaching our bodies to fight off the COVID-19 virus. The vaccine is, again, it's not new technology, but it's relatively new for an infectious disease. And the testing was done just as rigorously as it has been for the vaccines that took much longer to launch. There are two big differences. One is they had essentially, not quite, but almost unlimited funding to get this done, to make it happen. So because of the urgency of this pandemic, the number of people who were dying, and the importance of getting our people protected and safe, there was a vast amount of resources available to do the development and get the trial run quickly. The other thing they did is that they did the same rigor of trials as they've done with older vaccines. They just would start one arm of the trial, and then when that was going well, rather than stopping and waiting a while and processing all the data, they processed the data really quickly and started the next arm right away. So the numbers of people that received this vaccine that were volunteers to test it out to see if it was good are similar to the numbers from older vaccines. We just processed them through more quickly and came to the conclusion that this is an extraordinarily safe and extremely effective vaccine. I was in line day 2 that it was available for me to get it. I only couldn't go day 1 because I was working in the COVID clinic. So, and I hope that's a good start. Mary, what else do you think? Or, and of course, if you all have questions.
Kathy, can I ask you then, oftentimes people will say, well, which one did you get, Pfizer or Moderna? Which one do you think's better? So I'd love to hear how you respond to that. And then also if you'd share how you felt after you got the vaccine for people who haven't yet, or wonder, how do you feel after the vaccine?
Yeah, great. Thanks, Mary. So Pfizer and Moderna vaccines are very, very similar, and the way that they work is the same. They use a little piece of mRNA, which is not the stuff in the middle of your cell that tells the cell how to reproduce. It's basically like a recipe. It's sort of like a little recipe that gets injected into your arm. The cells in your arm pull it in, and they say, oh, what's this? It's a recipe. We'll make this. And they construct the protein that is encoded in that little recipe. The recipe happens to be for a protein that looks like the stuff on the outside of the coronavirus. It's not a part of the coronavirus. It can't make you sick. It teaches your body to recognize the virus. So they stick that little piece of protein on the outside of the cell. Then our cells say, wait a minute, this recipe, we don't need this. And it chews up the recipe. It's gone forever. So it's not like it sticks around and can cause trouble later because it's gone. And these little proteins end up on the outside of the cell, and our immune system start cruising around looking for trouble. And they say, oh, that protein, what is that? So they go and build an antibody to stick onto that protein because they want to eliminate it. And it teaches the body to recognize this little piece of foreign material that if we ever get exposed to coronavirus, we'll see a whole lot of it because it's all over the coronavirus. So the body now recognizes this little protein and can stick onto it and eliminate it before it makes us sick. There's no part of this vaccine that goes into the center of the cell and is incorporated in the DNA. In fact, there's no part of the vaccine that even sticks around any period of time. The body recognizes it as something foreign and even chews up the mRNA that is part of the vaccine. So they both work the same way. There's no leftover from the vaccine. There's no live virus. It can't give you coronavirus. It can make you feel kind of bad though. So as your body mounts this immune response, as your body sees a foreign invader, it tends to hype up the immune system a bit. And that is what can lead some people to have, I had a sore arm. I had quite a sore arm for a couple of days. Not enough to keep me out of work, but it wasn't very comfortable. Some people will get fever. Some people will get headaches. Some people will feel sick to their stomach. And that is just a sign that your body recognizes something's up and it is mobilizing resources. Those symptoms last on average 24 hours. Some people don't feel well for a couple of days and then it's gone. And that's the typical reaction.
So Kathy, before I turn to Doug, because I want to talk about inequities and how we field certain populations, I just want to underscore what I thought I heard you say, because another question we're asked a lot with people who are afraid, and you answered that it wasn't just developed in 5 months, and probably it has more efficacy and testing than lots of vaccines. But the concern about long-term effects that no one understands or knows, I feel like you mentioned that, but it's worth saying again why you feel so comfortable that that will not be the case.
So Mary, I'll tell you and I'll tell everybody out there, I am no fan of medicines or vaccines unless I feel like they're really safe and proven. And I was not going to allow something to be put in my body that I would be afraid would hurt me. And I wasn't going to recommend that to the people who were important to me either, to my mom, to my brother, to my friends. So in looking into this vaccine, one of the things that I think is impressive about it is that it causes this brisk reaction when you first get it. And then the way it is constructed, these people at Pfizer and Moderna are brilliant. The way it's constructed, it allows the body to say, hey, wait, we don't need this recipe. We don't need what is in the vaccine. And it takes it apart into little teeny pieces and it vanishes. So after receiving the vaccine in very short order, there's nothing left of the vaccine. All that's left is the memory of it and your body's ability to react to the virus should it show up.
A comment came in from Neil Hagler. He says the mRNA vaccine is a miracle, and he thanks you, Kathy, for your service.
Oh, thanks, Neil.
Neil, thank you. So let's turn a little attention, and this is a worry Doug and I share a lot, that how many of our communities, especially in the CHA Metro North area, Chelsea, Everett, Revere, and even Malden, those communities have struggled. They were essential workers, not protected, not covered for days staying at home. And we were all counting on these people in our grocery stores, et cetera. So we feel them, there was a lot of sickness. And now there's vaccine hesitancy. And the rollout hasn't really focused on this population. Doug, tell us, what do you think of all of this and what should we be doing?
Well, thank you, Mary, and it's great to see you. And Dr. Miller, thank you. That's a great explanation of all of this. It makes it very easy to understand and follow. And you are correct. It's a frustrating time right now here in Massachusetts as we look at the rollout of the vaccine itself and making sure that it is getting out to individuals and everyone that we can able to vaccinate as much as we are able and when we are able. I think one thing to keep in mind, and that we're seeing all over the news as well, is that the state is the one who's actually facilitating how the vaccine is being rolled out. Currently, what we have is we know that it was broken down into a variety of different phases. We've already gone through phase 1, and that's a lot of our healthcare providers, those who are working with individuals who are dealing with COVID right now, other healthcare workers who are seeing people doing more of that face-to-face type of work. Those of us who are doing clinics, whether we're doing the testing and or doing the vaccinating itself. And also our first responders who are out there, working every day, meeting individuals, not knowing what they're going into, possibly transporting individuals. So we have phase 1 that has been completed. If you're still in phase 1 and you're a member of phase 1 and haven't been vaccinated, you can still get vaccinated. Your time is not up yet, so please, go in and get vaccinated. The next group that was in it, which we are often hearing people talking about phase 2, group 1. Phase 2, Group 1 was our senior population over the age of 75. And that is anybody over the age of 75. And one thing that has changed a little bit with that is that in some clinics or some places where they're actually giving the vaccine, there is a chance that individuals who are transporting them or bringing them in and helping them, most likely their caregivers, can also get the vaccine with them. That's only available at the state locations though. That's not happening at a lot of our medical providers or even at some of our local clinics, those that are still available. We were lucky enough to be able to do some of that for our 75-plus-year-olds here in Somerville. And that was a great opportunity. And we worked very closely with our Council on Aging. Just recently, they've opened up the next phase, which is those over the age of 65 or those individuals with 2 or more medical conditions. And they're very specific about what those medical conditions are. And then they're also allowing for residents who live in low-income senior housing facilities as well. So that's one of the things that we're just kicking off right now, which is kind of an amazing thing. Again, and this is kind of going to a question that I got from one of our residents earlier today. So Rick, if you're listening, hello over on Columbus Avenue. I'm glad you're able to make the show today. It was a question that he asked was, you know, when you talk about that, how do we navigate through some of those processes and get to some of that? Well, the residents in the senior housing facilities, these are often the SHA or the Somerville Housing Authority building, or some of our other high rises that are dedicated to low-income individuals. So we will be coming out to those sites in partnership with the residents and the senior housing facilities to reach them. We still have a big gap. And a lot of that is the population, I think, Mary, that you're asking about. Those who were out there working in the grocery stores and some of our restaurants, the service industry. Right now, that population is not eligible to be vaccinated as of yet. That's coming up. That is what we often will hear as phase 2, group 3. So that will be coming up shortly. Right now, the state is telling us that that's probably going to be happening sometime in mid-March. Hopefully that will happen. I think part of the challenge that we keep hearing about is there's limited vaccine that's out there and our supply chain has been limited. The weather over the past couple of weeks has not also helped as well, but we are trying to get back onto track. Again, the state is the one who's actually telling us where and when the vaccine will become available. Local municipalities, we were part of it. We are no longer receiving vaccines right now from the state. We're hoping that they will reconsider and change that. So we're able to really focus on some of the communities that are hardest hit by this virus itself. In fact, earlier today, I was working with a regional group that includes Somerville, Cambridge, Everett, Malden, Medford, Chelsea, Revere, Winthrop, all of our communities to come together as a region to see if we are able to actually address this on a regional approach, making it a little bit easier for people to get the vaccine closer to where they live. Now, I agree, the state vaccine locations are a wonderful opportunity, but one size does not fit all. And we have to think about how we can make it convenient for people to get this vaccine. And one of the challenges that we keep seeing is that the state vaccine locations are not always convenient. So we have to work together.
Thanks, Doug. And we're going to pause, and we have a few questions that came in from Facebook. Sorry. Also, we're juggling between text and Facebook. Steve Baca, he asked us this question. If he is not a member at CHA, where in Somerville can I get a vaccine? I belong to Leahy and qualify with 2 comorbidities. And Kathy and Doug, both help out because I think the healthcare systems have fallen a little behind based on what Doug mentioned in terms of the state rollout. But Kathy, maybe you want to describe, we don't know other health systems sometimes, but we know how CHA is notifying patients, and maybe sharing that information would be helpful.
Well, I don't know if it's going to be so helpful to the person with Leahy Health, so I'm sorry that I may not have the best answer. CHA is outreaching to our patients, but I do know that unfortunately, people even who are in affiliated health systems, if you don't have a primary care doctor at CHA, then are not able to enroll you for vaccine. There are the state-based vaccine centers are probably your next best bet. I know those are challenging to sign up for. Doug, I don't know if you have other recommendations.
Yeah, so thank you. I think you are correct that the state sites are probably going to be your best bet right now. Unfortunately, in Somerville, we do not have additional vaccine that has been allocated to our community at this time. There are the state vaccine sites, and right now we know that the closest one to Somerville happens to be at Fenway Park. There are a few other clinics, and you can go into the state's website to identify that. And if you just go to www.mass.gov/info and details, and then it's the COVID-19 vaccination locations with a dash between each of those words. And I wish it was easier to do that, but I'm hoping that we'll be able to place that link on the call as well. There you can find out all the different locations. Additionally, one of the things that's kind of nice is we've even had some local over in Arlington, people who've been able to put together kind of an aggregator of all the different testing possibilities that are out there, as well as find out where those locations are at. And we'll post that link as well so that you can take a look at that. I know it's already posted on our city's website that Kathy mentioned earlier. If you just go to the city's website and do vaccines, you'll find some of these links as well, which does have it to the aggregator of the different places people can get vaccinated.
Steve, I hope that helps. And, I know it requires patience. We heard a lot about people trying to get onto the state site and it crashed. But as Doug said, you are eligible with the comorbidities on that site. And hopefully they have that operating more smoothly. We do have 9 questions in chat. So what I'm going to do is try to go to chat. And you might lose me, but whoever can jump in and answer. And thank you, folks, for writing in. There are 2 questions.
Mary,
yes.
There are a few questions in the Q&A on the Zoom. Do you mind if I address those?
Please, Kathy. Thank you.
So the first question was, what if you have a really weak immune system? Then could it possibly give you COVID? Super good question. I was thinking, how can I best explain how it cannot do that? Some vaccines, very few anymore, actually have a little bit of the virus that can make you sick, and they sort of knock it down and make it weak, and then they give you that weakened form of the virus. The COVID vaccine is not like that at all. It's almost like I was thinking about sort of like Where's Waldo, the guy with the striped shirt and the funny hat. The vaccine, basically, if you imagine the COVID virus like that with the little hat, the vaccine is training your body to recognize the hat, not the guy, just his hat. So they give you like a copy of his hat. His hat can't hurt you. It's teaching your body to recognize just a little teeny piece of the outside of the virus, not the part that makes you sick. So it doesn't matter how weak your immune system is, you can't get COVID from the vaccine. Nobody can. And it does not change your DNA. It's like that was another question. Does it change your DNA? It absolutely does not. This vaccine does not go into the center of the cell where the DNA hangs out. It gives your body this little recipe to make a protein, then it tears up the recipe. So it's there for a little while, then it's gone.
So now we have another asking, what if my very serious medical conditions are not on the list?
And so the serious medical conditions are pretty restrictive. And if they're not on the list, then you'll be waiting for the next wave of vaccines. And I'm sorry, it would be great if we had enough vaccines and enough capacity to give everybody a vaccine today. But we're not there yet. And for everyone, whether your comorbidities are on the list or they're not, and if you're vaccinated or if you aren't, please continue to follow the same carefulness that you've been following up until now. That's use a mask anytime you're outside. Wash your hands often, don't touch your eyes. Try not to have close contact with anybody who doesn't live in your house with you, because that's the best way we're going to make it through this as safely as we can.
Doug, I'm sure you'll love answering this one. It's about why the state did not necessarily let the comorbidity, 2+ comorbidity folks get vaccinated first, in the difficulty they're having with appointments. I thought you might want to jump in.
Sure. If you give me all the controversial questions, don't you? So I do agree that, that's a challenge. What we do know is that, when we look here in Massachusetts, we've already given over 1 million vaccines, which is great. We hope that we are able to give a lot more as we move forward. Within that, the state is really trying to make sure that we're able to open these up and move them forward as quickly as we are able. When we look at the way the state has decided to move this forward, there was a panel that really reviewed all the data and all the information and made these criteria to move us forward. In order for us to continue to be able to have that vaccine, we have to follow those orders and follow that direction in the phasing processes that they have. The state is really trying to make decisions about who's most at risk of having a negative impact with this virus if they were to get infected with it. So that's how they've come up with the criteria in which they're moving forward with it. So we have to follow that. We are obviously trying to get them to look at that and modify it and or do additional explanations when there's uncertainty and unclarity within that. I wish I could add more into that, but unfortunately, that's where the state is at with us.
Doug, thank you. And public health is about advocacy. It's about pushing to do the right thing. I know Doug spends so much time doing that, and many of us, as he said, in the regional front do that with him. I wanted to switch gears just a little and ask about the variants that are happening, and concern about if you are vaccinated and how you know that you'll still be protected with different variants. And then also, people are wondering if we can't roll out the vaccine more quickly, could we face a third surge?
So fortunately, it looks like the vaccine is still effective on the variants that we know about. Perhaps slightly less effective, but still effective. And the fact that this virus is mutating, because the more of it that's out there and the more times it reproduces, the more opportunities there are for the virus to change just a little bit when it reproduces. Sometimes, however it changes, it will be less able to pass one person to another, but sometimes it'll be more. And so that's where we find ourselves. The best way to stop these mutations is actually to stop reproduction of the virus, and that's by getting vaccinated and not spreading it.
And can I just add, I'm sorry, doctor, if I could just add on to that, I think this is probably where you were going to go with this as well, is that we know how we can protect ourselves as well. And that's really following the public health practices we all keep talking about. We know that the masks themselves, and wearing a mask that does cover your nose and your mouth and wearing it all the time, and it can be a tight fitting mask as well, will help protect you. It really will clear out, a large percentage of the droplets from getting into your body or from you sharing it if you were to be infected. And then, of course, we want to make sure that we have that social distancing so those droplets are not spreading and they're not passing to one another. And of course, make sure you wash your hands a lot. We just even know that whenever the flu virus is around every year. What do we ask you to do? We ask you to wash your hands a lot in the wintertime, because we're touching things and then we're touching our faces and our mouths. Those are the things that we want to avoid to do. So we know how to protect ourselves. We just need to continue to do that.
So Doug, since you mentioned the flu, when we all know the flu is down this year in Massachusetts, and I'm sure some of it is the great advice you and Kathy are giving about hygiene, washing your hands, and some of it is probably not being around as many people when you're sick, but other thoughts related to how we're struggling with COVID, but we've done a great job on the minimizing of the spread of the flu, thus far at least.
Yeah, I think you answered your own question, Mary. That's great. We like to do that, but you're correct. But even just going back to what we do know about the flu virus, it really doesn't start up in our hemisphere. It usually starts down in the southern hemisphere, and then it slowly migrates up north and into our hemispheres and everything. So when we look at that, we also know that they had a lower percentage rate as well because of the COVID and using the protection, and the virus really didn't have a chance, as Dr. Miller had mentioned. The best way is don't let it reproduce. And if it's not having a good chance of doing that, you do have a better shot of not having a strong presence of it as it continues to move forward. That's what we had around this flu season as well. When it did arrive, we already had people who were wearing the face coverings, covering their nose and their mouths. They were social distancing. They were washing their hands a lot. So we were not, the virus wasn't able to reproduce. So we weren't seeing the infection rates that we had. Those people everybody who got their flu vaccine, including me, I'm still glad I did it. That still helps me. In fact, there's a chance that may have also just kept me a little bit more vigilant about making sure that I'm wearing my mask correctly, that I'm washing my hands, and that I'm social distancing from everybody. I mean, Mary, I only get to see you on camera now. We never see each other face to face.
But plan on it when it gets warmer. Distance walking. We're lonely, and maybe Kathy wants to talk about some of her patients in the loneliness. It's been tough, and there's so many other issues related to equity and food access. I'm a volunteer at CHA Revere Produce Market, and we went from 250 meals to doing 600 bags for people. So maybe comment on what your patients are saying about loneliness and interacting. And we're stretching people worrying about rent and food, but also parents are teachers now. Parents are on childcare. Parents are working. It's a lot. So mental health has come up a lot, the stress that people are dealing with. Maybe you can comment.
Thanks, Mary. So certainly it's been a very sobering time as a doctor, not only to see people so darn sick and so worried about their families, but also to see the suffering that has come about from the social isolation, from being just a little bit scared all the time that you're going to get sick or someone important to you is going to get sick, or if you got sick that you could get it again, because unfortunately that can happen. And there are a few things that I think are really, really helpful to keep in mind as far as when you're feeling that loneliness and isolation. The one thing, which is probably the hardest thing, but I'm going to ask you all, I don't know if any of you out there are my patients. I love my patients. So I'm acting like I'm talking to my patients. All right. So the most important thing is don't give up. Because if you give up now and you start going out and going to church and going to restaurants and hanging out with your friends and your family without masks, then we're going to find ourselves in a terrible situation again. And all of those fears, unfortunately, have a higher likelihood of getting closer to real. So please hang in there, people. Call your friends, figure out how to do FaceTime or video chat or whatever you need to on the days when it's a little brighter and sunnier. Try and get outside with your mask and go for a walk with the people important to you. But hang in there because we're getting closer. Numbers are lower and we're getting closer to something that looks a little bit more like normal. But this is super not the time to give up. When I see people in the clinic where I work and they say, I wear a mask all the time. I don't know where I got this. And I say, well, where have you been? What have you done? Well, I went to church, which is horrible that we can't go to church and find our faith and feel safe there. But it's unfortunately, a lot of people are getting sick there. You go and sing with joy and it unfortunately causes a bunch of the virus to show up in the air around you. So go online, talk to your friends on video. I know it's not the same. Or I got together with my family and we all got COVID tested and then we all got together. And unfortunately, a negative COVID test doesn't mean you're not sharing the virus. And that's a big topic. But just so you know, just because you had a negative test doesn't mean you're safe. It means you didn't have virus in your nose that day if the test was effective. But tomorrow, we don't know. So please don't put too much faith in a negative test. Act the same. Use your mask. Keep your distance. Try and make a schedule every day. Set up times when you can talk to your friends and your family in a safe way. It makes you feel better.
Kathy, will you remind, we've got one viewer that asked, is it still 6 feet distance is the right amount? So do you want to, yeah.
Yes.
Yeah.
6 feet distance. There's a lot of talk about different distancing and does it need to be 12 feet? 6 feet is a minimum. So if you're 12 feet, that's better. but no closer than 6. And as far as the masks, oh, I don't have a surgical mask on me. I should have put one in my pocket. So if you have the little cloth surgical mask, one thing you can do is on the ear thing, tie a little knot in the ear thing so it's real close together and tuck the insides in. It makes it fit a little closer to your face and keeps you even safer. And if you use a surgical mask with a cloth mask on top of that, that's even better. If you just have a cloth mask, that's fine. Don't put on like 5 masks because then all the air leaks out around and doesn't save you. So you want to be breathing through the fabric of the mask and have it fit nice and tight to your face. Wearing it here or as a chin warmer does not help you or anyone else. So please do your best.
You're probably spreading some infection there, putting it up and down. One vaccine instead of the 2. Some people feel, oh, I got my first COVID shot, and they feel protected enough. So can you comment, both of you, on rallying to get that second shot and why it's so important?
Doug, you want to take that one?
Sure. Yes, we want you to get your second shot. And believe me, the state has assured us that the second shot will be available for anybody who has the first shot. It is important to do so because what we do know about this virus is that it does take a little bit of time to build up. And as the doctor was talking about, it has to recognize those things. And after the first shot, we know that you're going to get some protection from that, but it's not complete. And that's why we need to have almost like that little booster shot to make sure that it continues to go through that. So instead of thinking my booster shot is going to be a couple years down the road, no, it's that time period as illustrated by or as defined by the different manufacturer, depending upon which vaccine you're getting. So we still really encourage you that if you get the first one, that's not enough. You need to go back and get your second shot in order to make sure that you do get that protection that you're needing.
We also think that the second vaccine will help the protection last a whole lot longer. So if you dose your body up with the vaccine and it learns to recognize that protein, but if you don't remind it, it's going to forget, if you want to think about it that way. And so we want all of us to stay protected as long as we can, which means the second dose of the vaccine.
Do we know yet how long we think the vaccine will protect us? Is there any more current data or research?
No, we don't have that information as of yet. Keep in mind that, we've really only been looking at this for a year. Here in Somerville, believe it or not, we're almost coming up to our anniversary of 1 year of really having a lot of this information. I was talking to some of my staff earlier today, and we kind of looked at each other and went, wow, it's been a year since we've really been talking about this and started to put some things into place. And it's like, yes, it has been. So it hasn't been a long time period that we've had here. So we really don't know how long the immunities, well, we don't know how long the vaccine is going to help support us. It doesn't give us immunities. You could still possibly get COVID. It's just that this is going to help you not get sick from COVID itself. So we want to continue to, and why we need to continue to use those public health practices we keep talking about. Even after we're vaccinated, we still need to wear the face coverings. It's covering your nose and your mouth, washing your hands and doing that social distancing as well.
I'm going to shift gears one more time because I keep thinking about the inequities and the disproportionate number of vaccines going to our communities that were hardest hit. Can both of you comment a little on thoughts and campaigns of getting that information to people, how, who, where to make a difference, to increase the numbers getting vaccinated from our folks who face the most inequities early on?
Yeah, I can start, and then Dr. Miller, if you want to take it from there, that would be great. Any way, every way, and always are the ways that we need to get the message out there, because we need to make sure that everybody has access to the vaccine itself. It is difficult, and part of that is that we have to rely on a variety of ways to do that, whether that's through our healthcare providers, whether that's through our faith-based organizations, our community-based agencies, our libraries, any place where people feel a trust in the community is an important place to get the message out there. Part of what we really hope that we're able to do tonight and in other meetings like this is to eliminate some of the fear that people may have and stifle some of that, because the vaccine is safe. And if we want to continue to move forward, this is one of the tools in our toolbox that we need in order to get back to some normalcy here. So one of the things that we're trying to do is really work with the state to really identify ways that we're able to maybe support our local boards of health to try and help them get vaccine back, in making sure that we're making the vaccine accessible. Now, some people say, well, accessible, all kinds of places can be accessible. Well, it's not just about access, it's also about convenience. We have to keep in mind that right now, many of our sites are only open 8 to 5. Well, if you're working 8 to 5, how are you going to get your vaccine? Plus, many of you, including the people I've talked to today, have been on the phone for hours waiting to have that phone line picked up. We know that you can call 211, which is the state phone line, but you might be on hold for an hour or longer. Their website is often crashing because of the overwhelming response. We need to hang on. We need to stay. We need to do that. That's for people who have the access and easy or have the time to do that. When we're talking about some of our communities that are, living paycheck to paycheck, or people who have multiple jobs, then it may not have the same capacities or the same abilities to do some of that. So we have to eliminate some of those barriers if we want to continue to move forward. That's what local boards of health are trying to do. We need the buy-in from the state. I'm going to put a little plug in here. We need the buy-in from the state in order to make sure that that happens as well.
Thanks, Doug. And Kathy, I don't know if you want to add, and I'm going to make sure we're answering all the questions that we've been asked.
I don't have a lot to add, Doug. I think I can speak from within Cambridge Health Alliance that we've been doing a lot of outreach to groups, particularly groups who have a different first language than English, so outreach in Spanish and Portuguese and Creole as well, trying to help our beloved patients learn more about the vaccine and have their fears calmed a little bit. One of the best things that I think we can do is folks who are getting high quality scientific information, like we're trying really hard to promote tonight, please share that with your friends and family and communities who may have doubts, and help them learn some of the answers to their questions, like about safety, about if these vaccines change the DNA, about if you can actually get COVID from the vaccine. So if you feel like you learned something tonight, please share that.
Okay, thank you. Dana, I'm going to direct this question to you about homebound populations and getting vaccinated. I know you've done some of this work.
Yeah, so we have a few residents who are homebound, which means they haven't been able to get out, or they're stuck at home and they are not able to move or be mobile and don't have somebody that can assist them to get to a vaccine. The city does have a list of individuals who may be homebound. We do ask that you work with your primary care provider to make sure that that is an accurate statement, so that we then can come in and assist you. If there are people who do need that kind of a support, they can certainly call the city and ask for the public health nurse, and Sarah will take your name down and be able to vaccinate you. We don't know when, because again, the city still doesn't have any vaccine. So unfortunately, it's not going to get you on the list. It's not going to get you vaccinated any faster, because we don't have any of the vaccine as of yet. As soon as we make them available, or as soon as we know that they would be available, we certainly would be able to try and get out to help individuals. Again, we have to look at this kind of as a community process as well. We all have to work together on this, because we do know right now there is limited vaccine that's available. So we do ask people to kind of think about this in a way that as they look at the vaccines and when they need to get to a vaccine clinic, who has access or who may have more of the abilities to get to some of these places, whether that be Gillette or Fenway or one of the other mass locations. And if you're able to get to those, that's great. Help out, that would be a good way of doing it. That way, for those who may not have the same accessibility or a little bit more challenged about getting around, that they're able to use some of the vaccine sites that are a little bit closer in. And hopefully we'll have more of those as time rolls on. One thing that we are looking at and trying to understand is that we keep hearing on the news that Pfizer and Moderna and now even Johnson & Johnson are starting to produce a lot more vaccine. That's fantastic. Hopefully as those start to open up and as that availability becomes more and more accessible for a variety of people, including the state will be able to say, great, we now have that available. Let's see who else can actually host these clinics and be able to do those as we move forward. Let me reassure you, the City of Somerville and HHS is ready to do that. We've already had a great conversation with CHA, who's been our partner on so many different projects. This is another one of those projects that we're already talking about. How do we bring it to all of our community members in an easy, accessible, convenient way? But we're also working with our neighbors and our partnering communities as well to make sure that they have that as well. You know, we can't do it alone. This has to be a community effort, just like it has to be a community effort to slow the spread of this virus. We all need to do our part to protect ourselves, wearing that face covering, washing your hands a lot, and social distancing. That's a step. Getting vaccinated and sharing the right information, not misinformation about the vaccine, is another important piece. So together, hopefully by next year, we're all back to a lot more normalcy and we're able to celebrate all those things that we've missed over the past year. I have not seen my family in a year because I'm not from here originally. My family is a distance away. I get to talk to them. I miss them. I miss the holidays. I miss birthdays and celebrations, and graduations. It'd be nice to get back to those things, but we have to do it together in order to get there.
Catherine Kind just sent a question. I'm so glad she did because this was on my list that's sitting on my desk while I'm here at my sister's. And she asked, do you know how long after the first shot, what the length is before you're protected, before the protection takes effect, and generally after the second one? She also asked us if there is a difference between the manufacturers. But Kathy, maybe you can answer this one.
Sure. So again, a great question. And these vaccines are amazing. They actually lead the body to take action very quickly to start recognizing those foreign proteins that can be on the COVID-19 virus. So they find that production of antibodies can start within about a week of that first dose. It's really impressive. Although maximum effect is about 3 to 4 weeks after your second dose. So I celebrate the relief on the patients that I'm working with when they receive their vaccine doses. That isn't to say though that once you get your vaccine, you can take your mask off and quit washing your hands and go around kissing everybody, because we can still get the virus on us and in us. It's just not going to make us sick, or not nearly as sick. So while I'm really happy that I'm less likely to end up in the hospital, because I work with COVID patients every day at work, end up in the hospital as a patient, I should say, I am still taking all of the same precautions because I could still pick up that virus and accidentally sneeze it on somebody if I weren't wearing my mask. So y'all, when you get your vaccine, please continue to be careful and show the love for all of your fellow humans out there by protecting them and being safe.
I wanted to just say that we've answered all of the questions now. Some of our colleagues are telling us that we're at the end of the show. And so I thought it might be fun just to ask you a personal question each. What are you doing to take care of yourselves, besides the protection, Kathy, that you talk about in that incredible work that you're doing in the respiratory clinic? But what are you doing to try to take care of yourself and relax? And then Doug, you tell us what that is for you.
Thanks for asking. I tell the same thing to my patients. It's so important to get outside in the fresh air every day, fresh air filtered by a mask. And my Somerville yoga studio, I won't plug them because I'll probably get in trouble, but my yoga teachers are amazing, and I can go online and look at their class and get some stretching and some deep breathing, and snuggling my cat, since he is my quarantine buddy. So yes.
Thank you, thank you. Doug, how about you?
So for me, I agree. I try and get out and when I'm able to get outside and do a little bit of walking or exercise in that way. But what's amazing is I have an amazing network of friends who I get to share stories with and uh, Zoom cocktail hours and we still try and stay in touch to make sure that we're able to do that. I have friends across the country, actually around the world, and this is one way that we're able to still stay in touch. Where we set a time when we can all come together and have that Zoom party and get together and talk and laugh and tell stories. And what's fun is that in one group, we actually have assigned a person that has to go back and look for photos, and they have to put together a little slideshow of past activities and events that we have done so that we can all sit and laugh and chuckle about how strange we were back when we were younger, or the fun activities that we got to do. And then we start planning about, okay, so when can we get together? Whether it be to get together and do our card game, which we do on an annual basis. We had to skip it last year. We're trying to plan it for this year. But we all put rules and stuff into that to make sure that we can stay safe, stay healthy, but be there to support one another. And that's how I kind of keep my smiles going.
Thank you. We got one last quote, lots of thanks for watching, but one last question. And I did want to say, Doug's such a kind person and friend that if we haven't talked for a day, he'll check in and say, just wondering how you're doing. And I think so many people have done that. They've stepped up during this time to check in on one another. But now that I've got us all a little relaxed, one last question, and I think we mentioned some of this, but Luis Alvarez asked, she's wondering, or he's wondering how the homebound elders will be notified when the vaccine is available. So we talked a little bit about homebound, and let this be the last question other than the thank yous you're getting, both of you.
Well, great. Thank you, everybody, for all of this. And Mary is a trooper through all of this as well. And I thank her for her friendship. For the homebound individuals, call us and let us know, and we'll call you when we have vaccine available. But that's for the homebound individuals. If they are able to get out, or if they are able to get an appointment at another location, absolutely, please don't hesitate to try and do that. If you do have that, if you're able to do it, and you're able to do it safely. If not, just let us know, and we'll let you know when those are available. We don't know, but as long as your name is on the list, and we have your phone number and your contact information, we can do that. You can simply call 311 and ask for the public health nurse, or you can dial 617-625-6600, extension 4320.
And maybe we should end how we started and ask Kathy Piantagini, who does head the Somerville Public Library, which is open, not open for you to go into and take out books, but tell us a second about how the library is operating to continue to be a resource to the Somerville folks.
Oh, thank you, Mary. Well, first, before I get into that, I just quickly want to say, I actually witnessed you on the phone with Doug one morning. Do you remember when I was driving by? And I thought you were talking to Ann, and you were like, oh no, I was on the phone with Doug. And also, I was also the recipient of Doug's kindness when he kindly followed up with me directly about a couple of questions I had. So thank you. But our libraries are open every day, Monday through Sunday at the Central Library. Our patrons, unfortunately, can't come into our buildings right now, but we're offering contactless pickup. So you can either call and request material, and we can put those on hold for you, or you can request them directly online. And we do have an outdoor Wi-Fi pop-up that we installed in front of the Central Library, which has been operating since January. So if folks need free internet access, you're welcome to come by. There's actually space heaters, and they do work pretty well. You might want to wait till there's less snow and rain, but anyway, it's there for you. So
Kathy, thank you. And there's lots of good information in the chat. The city of Somerville has been doing tremendous work. I am very proud of born and raised here of the city, but also a patient since I was a teenager of CHA. And we continue to do such wonderful work, and the partnership makes a difference. So thanks so much, everyone, for being here tonight. We hope we answered your questions. We're glad to keep getting questions from you and answer in other ways, but appreciate your time tonight. Take care of yourself. Lots of good information tonight. And I know you're all waiting to get that vaccination, and tell families and friends and give us ideas about how we can assure people, especially people with different backgrounds and ethnicities who did not feel that they were being embraced early on in healthcare. Let us help make sure that we can get the vaccine and provide trust and confidence. So thank you. Good night, everyone.
Thank you, everyone.
All right. Bye-bye.
Good night. Stay safe out there.
Yes.
Be well, everyone.
Okay, read books. It helps. Bye.